Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to our weekly news conference for the latest in COVID-19 information for the Amarillo community. We do these every Wednesday at 11 a.m. Let me introduce who is on our panel this morning. We're joined by Amarillo Mayor Ginger Nelson, Casey Stoughton, Public Health Director for the City of Amarillo, Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Lamenter, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and Amarillo City Manager Jarrod Miller. What we'll do is we'll open it up to our panel for some opening statements, and then we will take questions from our media members who are participating. Let's go ahead and start with Amarillo Mayor Ginger Nelson. Mayor, how are you this morning?
I'm well, Dave. Thank you. And good morning, Amarillo. Well, 2020 continues to deliver different things for us outside of our normal expectations, and the weather would be one of those things this week. So I hope you're warm, I hope you're dry, and I'm thankful for the rain that we're getting. The only thing I really have to speak of this morning is just to encourage people to get their flu shots. I've gotten my flu shot. It hurts for just a second, but it's going to, I think, keep me safe this winter, certainly from the flu. But it helps me also just fight against COVID and other things. So just go ahead and make a mental note, find out where you're going to do that. And Casey, maybe you can give us some information about how to do that at Public Health in your comments. But more than anything, Amarillo, I just want to say thank you. Thank you for not growing tired of doing good things and making the right choices. Thank you for whatever you've had to change to keep your business open, to send your kids off to school. It's helping. Look, we're feeling sort of normal now, and doesn't it feel great? So if you're wearing masks, I really appreciate that. If you're staying home because you have symptoms, we all appreciate that very much. And I just want to say thank you, and I'll hand it back to you, Dave.
Thank you, Mayor. We'll now go to Casey Stoughton, Public Health Director for the City of Amarillo. Casey, how are you today?
I'm good. Good morning, everyone. So just a cap of the numbers this morning. As of yesterday, there were a total of 6,535 cases of COVID-19 reported in our community, 4,194 cases in Potter County, and 2,341 cases in Randall County. We have a total of 5,862 recoveries, and we do have an increase to 89 deaths to report in our community today. That leaves us with 583 active cases. Each of the cases do represent a unique individual. The rolling 7-day average for Potter and Randall County is 10.29%, and the positivity rate at the drive-through testing site is around 30%. The public health drive-through testing site does remain operational, and individuals can call 378-6300 in order to schedule a test. That number, 378-6300, is also the number that you can call to schedule an appointment for immunizations. We currently don't have our supply of flu vaccine. We're still waiting for that supply. We do have the full menu of vaccines for both children and adults. And so if you need a vaccine, maybe back to school, or another vaccine if you have a new baby coming and you need a Tdap vaccine, we're happy to provide that for you. So you can make an appointment for both the drive-through testing site and immunizations at 378-6300. We do echo the mayor's statements with regard to masking and social distancing and staying home if you're symptomatic with symptoms related to COVID. We certainly appreciate everyone's work as this response and our COVID-19 efforts stretch into months. And so we know that this is getting long, and we appreciate everyone's work. We do look forward to a time when there is a COVID vaccine. Right now, we do have a flu vaccine, and we encourage you to get that vaccine. Even though we don't have our supply at the Public Health Department, we have lots and lots of places in our community where you can get that, including your doctor's office, local pharmacies like CVS, Walgreens, United. All of the local pharmacies will have their supplies. So check for availability, and then we'll have our supply, and I'll let you know as soon as we do here on our news conferences. That's all I have today, Dave. Thank you.
Thank you, Casey. Let's now go to Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center. Dr. Milton, how are you? Hey, Dr. Milton, how are you?
There we go. Can you hear me?
Yes,
Yeah.
we can. How are you?
Good. I'm good. So this morning, yes, I wanted to state also, as the mayor and Casey had mentioned, that to get your flu shot, I got mine a couple of weeks ago. We've had ours here over at Texas Tech for a little while now, so it's a good idea to do that under these circumstances, especially. A little bit more about vaccines. There's a big effort, as we all know, about trying to develop a vaccine for this new coronavirus. And one company is called Moderna, and I just want to discuss just a few brief talking points about that vaccine and what they're doing. They're enrolling up to 30,000 people over 89 sites, and seem to be in the latter stages of their phase 3 trials. This type of vaccine, this technology, is what we call an mRNA, or a messenger RNA. And that top technology has actually been around 25 or 30 years. There's advantages to each of these technologies, but specifically this type of vaccine has a high potency. Apparently the capacity to develop rapid development is there, and there's a potential that it has a potential low cost and safe administration. As I said, they're in the phase 3 trial, and essentially what they're doing when they're in their phase 3 of their trial, they're going to give what we call a blinded study, which means that half receive the vaccine and half receive a placebo. But that's blinded. In other words, the people don't know whether they're receiving the placebo or receiving the vaccine. And then those individuals are followed for complications. Within the last 24 hours, there was another company called AstraZeneca who's also conducting a vaccine trial. And you may have read that there was one complication apparently that occurred in one of the patients or one of the volunteers who received the vaccine. That's being investigated by now. And I think it's an example of how so much care is put into the safety of these vaccines to try to ensure the public that you're going to get a safe and effective product. So as time goes on, there'll be other vaccines that I'll try to briefly talk about and give us updates. And that's all I have this morning, Dave. Thank you.
Thank you, Dr. Milton. We'll now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you today?
I'm cold, Dave. I don't know who really turn off summer so quickly. But anyway, I want to make another case for wearing a mask. As I realized this morning, wearing a mask is a great way to keep your face warm when the wind is chilly. So all the more reasons why masks should be worn as we fall headlong into winter already. So September 18th is going to mark the 6-month mark of our first positive at Northwest. And you think about how dramatic the changes in this world have been in the last 6 months. But also think about how much we've learned about this virus, as Dr. Milton talked about. And Dr. Lamenter and I have talked a lot about being part of these consensus groups. And these are groups that mostly on our corporate structures where we are talking to other healthcare providers and experts around the country as what is the best evidence as to how to best take care of patients with COVID-19. And I was on one of these last week, and one thing is across the country, everyone said that no role for hydroxychloroquine in the treatment of people with COVID-19. I think that's a done deal. But we talked about remdesivir, and this is a drug that we keep bringing up as a treatment for patients with COVID-19. It was interesting. The same experience that was seen by my colleagues around the country, which is the sooner you start this drug in people who are diagnosed with COVID-19, the better off they do, and the more effect you get out of the medication. And so much so that the government has now said that they recommend starting this drug not only in people who are diagnosed with COVID-19 based on a test, but those who are suspected to have COVID-19. What that means is in the last 6 months, we have been able to recognize almost a case definition of what is COVID-19. And I know Dr. Milton sees this every day, but based on diagnostic imaging, CT scans, and labs, we can essentially say this is COVID-19, even without a test. And sometimes it takes us several tests before that patient is confirmed positive. So we now know that if we can start the remdesivir, even on the suspicion of COVID-19, a lot of times we can end the treatment within 5 days and see a significant clinical improvement. So it's kind of changing the way we're using this drug at this point. In terms of our numbers at Northwest, we have 18 positives. So we continue to drop by 1 or 2 positives every day throughout the last 3 weeks. We have 6 patients in the ICU and 3 of them are ventilators. Right now, we're using 25% of our ventilators in the hospital. A question came up last week, are we seeing any children or an increase in children with COVID-19? Right now, we have no children with COVID-19 in the hospital. We have seen an uptick in our employees, though, that are testing positive. And most of these are employees that are either getting it from the community or actually seeing employee-to-employee spread. So that's been more of a challenge as we had to quarantine more of our staff from some of those positives. In terms of remdesivir, we have enough to treat about 80 patients right now for 5-day courses of the medication. So we're doing very well on remdesivir. We're doing very well on PPE. No concerns there. We've been hoarding PPE the entire summer. So we're ready for the fall here. Visitation, right now we're allowing 2 visitors per room between the hours of 8 a.m. and 8 p.m. And I think that's critical. Like I say, again, we know how stressful it is for patients and families when they cannot be with their loved ones who are in the hospital. Testing, we've gone to multiple modalities. We're still doing the PCR testing. And now we're trying to move to that antigen testing I've talked about the last couple of weeks, so we can test every person that is admitted to the hospital or is getting a procedure in the hospital to make sure we're not missing anyone that might be an asymptomatic person with COVID-19. And I want to reemphasize flu shots as the mayor has and Casey. One last thing is, we've seen multiple articles and stories about how challenging the last 6 months have been for many people in terms of their jobs, their well-being, being isolated. And we know that this has effects on mental health. September is Suicide Prevention Awareness Month. And this is critical. It could not come at probably a better time. Tomorrow is actually the National Day of Suicide Prevention. And we do want to note that we will be showing an interview with Dr. Garcia, who's the medical director of the Pavilion, tomorrow night at 6 p.m. on our Facebook page to mark the day of suicide prevention. And Dr. Garcia has some incredible insights into how we can help each other maintain our mental health and prevent such a catastrophic act as suicide. So that's all I have for this morning. Thank you.
Thank you, Dr. Weiss. We're now going with Dr. Michael Lamenter, Chief Medical Officer for BSA. Dr. Lamenter, how are you?
I'm doing well. Thank you and good morning. I think the update for BSA is how I'll start today in terms of our statistics. We have 24 patients in-house currently that are confirmed COVID positive. We've hovered really over the past week or so with 27 to 29 inpatients. We'd have a couple of discharges matched with a couple of admissions and really have held steady at that number. 17 of our 24 patients are currently in the ICU, and of those 17, 5 are on the ventilator. We are still attempting to utilize a non-invasive approach to supply patients with higher flow rates of oxygen as much as possible until they must go on the vent, which has been our strategy for some time now, and it is working fairly well for some patients who can avoid mechanical ventilation. We've done now 8,728 total tests as of early this morning since the outset of the pandemic, and about a 17% overall positivity rate on those tests since the beginning. Those rates fluctuate month to month. July was a high month for us in terms of positives, about 20%. August was down lower in that 13 to 14% range, and we'll see where we end up in September as we start to encroach flu season. We now have also admitted over 500 unique COVID patients here at BSA since the outset of the pandemic. And that just, I think speaks to the significant number that our staff has been able to manage well. And again, the majority of those patients have done well and have survived. We unfortunately have certainly suffered some deaths here as we have throughout the nation. And that is to be expected, I think, for patients that get severe disease. Some of them will not recover, obviously. I think that I'd like to echo some of the comments made by our other health professionals today, and that is that number one, flu shot's critical. You've got to get your flu shot, in my opinion, unless you have a serious medical exemption. And some people do have medical exemptions and should not get the flu shot. But that is a very small minority. We do know that co-infection exists with COVID-19, meaning COVID-19 plus the flu. And that combination is going to be most likely far more lethal depending upon the individual patient and their background medical problems than if you had one of those viruses alone. So again, we're trying to be preventative here and recommending the flu shot. You cannot get the flu from the flu shot. I know you hear that every day from your physicians and other healthcare workers. You may get a local reaction is the most you would get. Very rarely patients would get an anaphylactic reaction, which is more severe. But please don't let those myths about the flu shot prevent you from getting one. I mentioned last week the Regeneron trial, which is a drug we're in a very, I think, critical trial here to see whether or not this monoclonal antibody against the spike protein of coronavirus is going to potentially be an effective therapy. So far, we've enrolled 7 patients in that trial, as I've discussed with our lead physician over that investigation. And so far, no deaths for patients that have received the medication. Too early to know whether or not, again, we're going to have a good result with this medication, but we did have one dramatic recovery with one patient. That could be a placebo the patient got, we don't know. Similar to really the vaccine scenario that Dr. Milton mentioned, one complication does not mean that certainly that vaccine trial is not going to be a good result. Briefly on vaccines for COVID-19, I appreciate Dr. Milton's comments today. The only thing I would add to that is that there have been some comments that we've seen in the press and elsewhere about folks that have gotten infected with COVID-19 and saying that, those individuals would be some of the first ones to say, I would not want a vaccine, would not get a vaccine. We don't know enough yet about whether or not the immunity that is generated from COVID-19 is worthy of giving you adequate protection, meaning vaccines are designed to give a hyperimmune response that causes a much more brisk development of antibodies than just natural infection. So we should not rule out people that have had previous infection. Once we get a vaccine that's been tested and shown to be safe, should also be considered for those individuals who have been infected. And the last thing I'll say is that I agree with Dr. Weiss in terms of the remdesivir comments. The scope of people we can treat has been expanded. We've now treated almost 100 patients at BSA with remdesivir. We are following the FDA guidelines regarding expanded use for hospitalized patients. And then lastly, the other drug that we mentioned that we're utilizing is dexamethasone, which is a systemic steroid. And the WHO just came out, it's the World Health Organization, with a commentary this week that basically said, after analyzing a large meta-analysis of several randomized trials, that yes, there does appear to be a mortality benefit when patients have severe COVID-19 infection and receive steroids. However, the caveat there is that for patients that have mild disease, they may do worse when they get steroids. So, kidding aside, when folks potentially have a mild infection and they're at home and not requiring hospitalization, they should not be just empirically, we say, or on their own, taking a steroid they may have in their cabinet left over from a different indication they've been prescribed. The steroids may be a problem if you're taking those for mild infection. We're using those in the hospital setting. I know Dr. Weiss and his team, and we are, for those patients that have severe infection, because there has been shown to be some benefit. So again, that's the summary today from BSA, and thank you for letting me participate.
Thank you, Dr. Lamenter. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well. Thank you, David. First, I want to report on our numbers here at the Amarillo VA. We currently have 5 inpatients, 1 in our ICU and 4 in our medical surgical ward. And then we have 14 veterans who are home on self-quarantine that we are also monitoring. And we do not have any veterans currently under a PUI categorization. I am happy to announce we have received our influenza vaccine. And so we have started vaccinating at clinic appointments if a veteran is requesting it. We do plan a flu fair that's looking to be the week of the 28th of September, and veterans should continue to watch for more information on that. That will not only be here in Amarillo, but also for our outlying CBOCs in Lubbock, Clovis, Dalhart, Childress. I know Dr. Weiss mentioned Suicide Prevention Month, and the team wanted me to mention it, and I was debating whether or not to put it on the COVID call, but I'm going to take this opportunity to say that we also are recognizing Suicide Prevention Month. And actually next week, September 15th, myself and some of our providers are going to be doing a telephone town hall with some of our veterans who may be at risk for suicide. And so we're going to be doing a veteran town hall specifically on suicide prevention here next week. And finally, I want to just take a moment to remember all those who have sacrificed so much on or after September 11th, 2001. This Friday, we'll be recognizing 19 years since that. I know it was a deciding point for many of our veterans to choose to defend our country. That same patriotism also is seen in many of our employees who have chosen to take care of those veterans. As an Operation Iraqi Freedom veteran who is deployed supporting fighting terrorism, I know it's important to take a moment to honor our fallen heroes from that day and those who have given their lives in the years that followed that tragedy. And so I ask each of you to just take a moment on Friday and just remember those that are serving and those that have served our country. And I'd like to thank once again the City of Amarillo for this opportunity to speak to our community and my fellow veterans.
Thank you, Dr. Gonzalez. Let's now go to Jarrod Miller, City Manager for Amarillo. Jarrod, how are
Thanks,
you?
Dave. Doing good. Thank you. And well said, Dr. Gonzalez. I want to remind everyone that the drive-through testing center is open, remains open. If you feel sick and you have symptoms you think might be COVID, call the public health hotline at 378-6300 to be screened for the drive-through testing center. The city still remains under, and the whole state still remains under the governor's executive orders GA-28 and GA-29. We go over those extremely briefly and then touch on one more item. GA-28 stipulates that there's no occupancy limits on a number of services, and those include essential critical infrastructure, religious services, local government operations, child care services, youth camps, recreational sports programs for youth and adults. We have 50% occupancy limits on outdoor areas, events, and establishments for professional, collegiate, or similar sporting events, amusement parks, swimming pools, water parks, museums, libraries, zoos, aquariums, and rodeos and equestrian events that are outdoor. We also have every other business is limited to no more than 50% of their capacity. The only exception to that is bars. They're still closed. However, I'll touch base on that just a little bit more later on. GA-29 is an additional executive order put out by the governor requiring that everyone wear masks in certain situations, face coverings. So that stipulates that every person shall wear a face covering over the nose and mouth when inside a commercial entity or other building or space open to the public, or when in outdoor spaces, wherever it's not feasible to maintain 6 feet of social distancing from another person not in the same household. There's a number of exceptions to the face mask requirement, but that is very much an exception to the rule. Finally, I mentioned that bars were still closed. However, the governor has directed the Texas Alcoholic Beverage Commission to make possible for bars to continue to operate. So the Texas Alcoholic Beverage Commission put out an industry notice dated August 25th, so not long ago, allowing bars to temporarily operate as a restaurant during the COVID-19 pandemic. To that end, the Amarillo Area Public Health District has issued interim rules for TABC licensed bars wanting to modify operations. Key takeaway is that our goal and environmental health's goal is to be as flexible as possible in coordination with the TABC to allow bars to operate as a restaurant if they so choose. We're working with a number of bars right now to do that, and we continue to be open and available to assist any bar that wants to look into that and wants to go through it the most efficient way possible. So we want to provide that assistance and guidance as requested and as needed. That's all I have, Dave.
Thank you, Jarrod. At this time, we're now going to go to members of our media. If you have a question for an individual panel member, that's perfectly fine, or you have a question for the entire panel, as a whole, you may go ahead and do that. Let's start with David Gay of Amarillo Globe News. David, how are you this morning?
I'm good. Good morning, everybody. I guess my first question is for Casey. I was in the past few days, I've been speaking with school district officials about their specific numbers for COVID-19. And one official told me that there was a possibility that the public health department was putting together a dashboard specifically related to school districts and their specific COVID-19 numbers. Is there any truth to that? And if so, when should people expect to see that go online?
Yes, so we're really excited about that, and I appreciate the question. So we're working on a dashboard that will allow our community to go to, it's like, it'll be a map, like an interactive map, just like the dashboard that we currently have. It'll be on that same platform. And so our community will be able to click on a campus, and there will be campus specific information related to COVID-19. And so we're working out those kinks now, and our IT department and our staff are developing that. And I anticipate maybe in the next week or so. Yes, and so we'll have more information about that as soon as it's rolled out.
And just to follow up, a couple follow-ups on that, will that include all 5 districts in the Potter-Randall County area?
Yes, sir, it will.
And then any higher education institutions or just the districts?
Right now, it will just be the ISDs, and then we hope to have the higher education, but that's a little more complicated. And so right now we'll just have the ISDs.
Sure. And the last question I have on this is how often will it be updated? Will it be updated once a week? Will it be updated once or constantly as cases come in? And will it go along with the report card sent out every day?
So that will be, and that's another great question. So that will be updated daily with our report card and the update to the dashboard.
Okay, fantastic.
So it's that 2:30 time frame.
Absolutely. And I think that's the only set of questions I have. Thank you, Dave.
Thank you, David. Let's now go to, if I'm not mistaken, Vanya Patino of News Channel 10. How are you this morning?
Sorry, Dave, it's Kevin Welch today.
I was close, Kevin.
It's okay. Casey, do you have any updates on testing of daycares and senior living facilities?
So not specifically to daycares. There aren't any specific guidelines related to daycares, but there have been some guidelines related to senior living facilities that have been pushed down through HHSC. And so I can get you those specifics. I can send you those specific requirements, or you're welcome to look at the HHSC website, but there are very specific requirements related to testing in long-term care facilities and nursing homes.
Thank you. And Casey, I missed what you said about the positivity rate of the drive-through testing. Could you tell me what that is?
So it's around 30% currently.
And Dr. Weiss, what about at Northwest? What's the positivity rate there?
Boy, I wish I could give you an exact number. We continue to get somewhere between typically about 4 and 8 positives a day. So I can tell you at the height of when we're seeing the high percentage, it was typically 10 to 14 a day. So 4 to 8 right now, but still seeing positives. Thankfully, not really translating into hospitalizations though. These are all patients who are going home and doing okay in the outpatient setting.
Okay. And Mayor, has your office or you been in contact with the governor's office about relaxing restrictions?
Actually, the West Texas Mayor's Coalition is setting a meeting with the governor, hopefully in the next week sometime. I fired off some dates that would work on my calendar just 2 days ago. So yes, I'm hoping that we will have a chance to visit with the governor, get his feelings on where he is, and let him know that West Texas is not Houston. West Texas is not the Metroplex. West Texas numbers seem to be plateaued, and we would like for that to be considered in how he's issued his orders. Now they're statewide, At times he has shown county by county. We were one of those counties where he held us back, didn't open us because our numbers were different than the rest of the state. So I think I'm looking forward to that conversation. And hopefully it will mean that West Texas will get a different look than what the entire state's getting.
Okay. And Dr. Milton, you said that you got your flu shot already. I've heard different accounts about timing so that you come out with immunity at the end of the flu season. Do you have any recommendations on timing of getting them, or just get them now?
I would recommend go ahead and getting them now because of COVID, and we've had some well documented cases in the spring of both influenza and COVID, and that seems to be a real entity. So I think in terms of immunity, it's typically thought that a flu shot you're going to have immunity at least 3 to 4 months, and but I think under these circumstances it's better to go ahead and get that now.
Okay, thank you all. That's it.
Thank you, Kevin. Let's now go to, if I'm not mistaken this time, Aaron Langston of KEMR Channel 4. Aaron, how are you this morning?